I want to thank you all for joining us this morning. We have a great presentation planned for you, and I think it's going to be very helpful and informative for all of our participants. And welcome to transit providers from across Missouri, the FTA, and MoDOT. Thank you all for joining us this morning. I also want to welcome and thank all the MPTA board members who have joined us today. Thank you for your leadership, especially during these challenging times that we are facing with the pandemic and the impact that is having to all of our transit services across Missouri. We really appreciate your leadership and thank you for joining us today. So as I said, the pandemic is creating challenging times in transit agencies across the country. We're hearing this on an everyday basis. It's in the national news. However, it's imperative as transit agencies continue to operate and provide essential service that you keep communication channels open with your employees at all times. Today, we have the opportunity to hear from two leaders in this area. So I'd like to welcome Susan Miller, who is the VP and Chief People Officer at the Kansas City Area Transportation Authority. Susan, I love your title. She oversees human resources, training, labor relations, and internal communications. She applies her diverse experience and skill set to driving a customer-centric and agile culture, drawing from her background that includes private sector management, business consultancy, entrepreneurship, and civic pursuits. She is a graduate of the University of Wisconsin. So welcome, Susan. We are happy to have you here with us today. And we also have our MPTA board member, Cindy Baker, who is the Chief External Affairs Officer at the Kansas City Area Transportation Authority. Cindy has 30+ years experience in all areas of transit communications and marketing, including media relations, digital communications, advertising, public relations, and market research. Her current role is responsible for message management, media relations, public relations, and CEO external and internal communications. And Cindy is actually the former president of the Missouri Public Transit Association as well. So welcome, Cindy, and welcome, Susan. We really look forward to hearing your presentation today. As they're speaking, we ask participants to please place your questions in the chat box. We will be answering those questions as the presentation progresses, and then we will also leave some time at the end for question and answer. So thank you all for joining us. Remember, if you're not speaking, to make sure that you are muted so we don't have any feedback. And I'm going to turn it over to Cindy and Susan. Thank you.
All right. Thank you, Kim. And thank you, everybody, for taking time out of your schedule. This may be one of many Zoom calls today, but we hope to make this a very productive one for you. Not that all of them aren't, but COVID has certainly changed the way we do business. And one of the opportunities we have with, even though COVID has been very devastating and many of your agencies have been severely impacted by it, there are opportunities, and we hope to point out some of those today. And one of those opportunities is certainly the way we communicate with our employees. The way we treat them, the way we communicate them is a direct correlation to the way they're going to treat and communicate with your customers. So it's absolutely critical, as Kim said, that they know what is going on, that you're upfront with them, and that you start with a very, very consistent, clean base. So we're going to get started here. Perhaps. Well, it didn't advance. Let's try again here. There we go. All right, so let me tell you just a little bit about KCATA, and many of you are familiar with us, but I think it's important that, first of all, you yourselves go through this exercise as you start to examine your own organizations. You need to know who your workforce is. We have 750 employees, and as you can see from the graphics, about 75% of them have direct facing customer contact, and then the other 25% are more support services. We're currently carrying about 30,000 passengers a day, and that's great, we feel like, considering where we started in March with the beginning of the pandemic. We've restored about 80% of our service is on the street, and that's pretty much where we plan to stay for a while. But we have been able to attract some passengers back. And part of that, I think, is due to the strong communications that we have with our employees, which they can then in turn communicate and inform our customers. I learned a new term today or this week from Susan. So we have in our graphics that we've got wired and non-wired. And then I found out the IT department calls us desks and non-desks. So you all know where you fit into your organization. But it's critical that when you start to inform your employees that you know exactly who you're talking to. Are they working from home or are they front facing? And the messages are very different. And their challenges are a little bit different. So when we started, we actually put well, as if the pandemic had a beginning, but when it was apparent back in February and March that we were going to be severely impacted, we created a crisis team. And part of that was creating the communications mission. And we knew that we needed to be as transparent and as proactive with our employees as we possibly could. And, there's already sort of a built-in an organization of our size, part union, mostly union and then the rest non-union. There's already a little bit of a distrust sometimes from new things. And so we knew it was very, very critical that we had a trusted source, a one-stop shop sort of, that people could get accurate and reliable COVID information. We also soon learned because, and Susan will talk a little bit more about this, but we very quickly, within about 3 weeks, had about 80% of our employees working remotely. And that was, not even something we thought about previously to any great length. And all of a sudden you have your remote workforce who needed reassurance. They were like, they're not sure what is going on for sure. But they needed to know that their supervisors, the leadership team still knows they're there, for instance. That still goes on. And then we needed very quickly to express a lot of gratitude. And sometimes it was easy to point out our drivers as heroes and our service workers and the people who were on the front line. But we also tried, and we'll show you some examples of that, to express our gratitude and encouragement and hope to those working at home, because there can, tend to be a little bit of an isolation feeling and just not sure what's going on campus, even though, we tried to communicate. So all of those are very, very critical. And I think this is a good point for me to introduce Susan Miller. She was and is our trusted source. She's new to the ATA in the last year. And in her role, she became the voice of COVID policy, information, and we would certainly find ways to promote information, but that one trusted source was Susan Miller, our new VP of People Development. So I think this is probably a good point for me to segue it over to Susan.
Thanks, Cindy, and thanks, Kim, for having us. I'm super excited to talk about this topic because I think it's really important, and as Cindy said, near and dear to, I think, one of the missions that I had coming in new to the agency also was to just communicate and engage our employees better. So even without COVID, I think this is a really important topic and something that we should all be looking at anyway. When we look at it through COVID, there is this continuity of operations that need to happen, so that some of that reassurance she was talking about, I think, is just the, we're still a public transit company. We're still putting service out there. We're just doing it a little different. And how that affects each employee's job is a little bit different. So if you are a bus operator, that means one thing. If you are a mechanic, that means another thing. If you are out working at the facilities bus stops, that's another thing. And if you are an office person, that we had a very 8 to 5 culture, and suddenly you were asked to take your computer home and work from home and go from an 8 to 5, set of measures to what's your outcome and your productivity, and learn how to navigate Zoom. Everybody really had a different type of thing that they needed to hear from us. But at the end of the day, they all really had the same things. I view all of these people as my colleagues. They're all a little nervous. They're all a little scared. There's a term I have later in the presentation that I heard that was called selective vulnerability. We're all going through it together, but yet we need to lead us down this path, and we're learning stuff every day. Things have stabilized a lot more than this particular slide from April that I'm talking about. But at the same time, people, when we started this, it was really, we needed to listen to our instincts and listen to our employees. What do we need to be talking about? And so the top 4 issues that people talked about were job security, their health concerns, childcare and homeschooling, and personal finance. Those were the top 4 things that people were concerned about in April. And if you go down the list, there's more about your employee status, your remote work, that kind of thing, work-life balance, stress. And so when I look at this slide, when we prepared for this, I realized that most of this is the same. People are still concerned, am I safe? Am I safe when I go to work? Am I safe when I go to the grocery store? And how to navigate through all that information. And what do we owe the employee, and what should we be talking about in a trusted source, because they do trust their employer to give them correct information. So we had this job to navigate through all of these things and then streamline down what they need to know. So some of those things are on this slide here, which is, research and best practices. What are other people doing? What's happening out in communities that are also serving the public? What are some of the things that are working and not? What are some of the things that are working at KCATA and not working? As we try new things and pull back, we need to kind of talk about why. The return to work, we did a lot of voluntary leaves, and when we immediately reduced service. And so some of those people that were away from campus for several months, and in some cases, when they were coming back, what's the information they need to know that might be a little bit different than everybody else? We have some of our employees that we would consider at risk for COVID. How do we communicate with them? And that kind of thing. So the middle section there is about the infection control procedures, the wearing the masks, 6-foot physical distancing, and cleanliness. Those 3 things have not changed. I'm amazed how many times we still remind people. Those are the 3 things that will keep us safe. Those are the 3 things that if we have somebody with COVID and they did those 3 things, then the people they interacted with, we get to keep working versus sending them home to quarantine. So those 3 things are just constantly being communicated. We're trying to come up with creative ways to do that. And personal responsibility and expectations is a really big thing. So go back to the 3 things. Everybody has a role personally and professionally while they're working for us or representing us to keep everybody safe, whether that's our employees, our colleagues, or the public. So how does that look like in your role? And then what are some of the operational changes that we make to keep everybody safe? I'm sure everybody on this call has made multiple operational changes. We don't board in the front anymore, we board in the back. The zero fare, the seats, some of them are blocked off. All of these things that we did suddenly, and we had to communicate to everybody in a way that was relevant and they understood the purpose, so they would carry on the operational change also. And then suddenly we're talking about medical support and things that we never imagined we'd be talking about on campus, and getting your temperature checked and your symptoms checked, and how to stay home when you're sick and who to call and all of that. So that middle section became kind of our life. And then over on the right, we've got the policies and requirements. So that was coming at everybody and still is constantly. What are the trends in the community? What are the guidelines? We went to mask mandatory, I think, fairly quickly in our city. Then there's state guidelines that we were at, 10% of capacity and 50%, and things were changing and it was very confusing. The CDC guidelines can be, as we all know, the website can be very confusing, as well as our policies were changing and how to be flexible for our workforce and let them know that they can take the time. Oops, sorry, my light went out. They can take the time that they need to be well and go through what they need to do also. So trying to get through all of that. We had temporary remote work agreements. We had workforce that had never been temporary, remote work. So what does that look like? And a lot of questions. Can we bring home our office chair? Do we get our double monitor and all of things, and how IT needs as well as continuity of work. For those folks that were on campus, how do we hold a meeting? How do you hold a Zoom meeting with somebody next door to your office? And it felt a little weird at first. Now I'm sure we're all comfortable doing it all the time. So a lot of those things were what we were required to disseminate and condense in a way that things that were relevant and they need to be aware of, we were able to let people know in a way that was impactful and important to them, so they felt safe and comfortable doing the work that they were doing, so we could continue our operations together. And then the last one, appreciation, gratitude, encouragement, hope. I think this one's really important. I think the leaders of KCATA do a really good job here, but it became even more important. And we also had the interesting mix of, you have frontline workers, and how do you define frontline workers in this environment? We're all working together, and everyone, again, has a different role in that, and we need to make sure we express gratitude, encouragement, and hope for everybody in the ways that they are contributing. You can go ahead, Cindy, to the next slide. And so some of those things I talked about a little bit, and Cindy did too, but so when we looked at kind of how we sat down and said, how can we communicate differently and most impactfully, if that's a word, we really needed to establish that transparency, integrity, and trust. So again, what we're communicating, how we're communicating it, establish a voice, research, measured. We need to be calm and confident, and this is that select vulnerability. We're all going through this together. We're all learning together, and that's okay. But then there's a point where we're also leading and making sure we establish the new norm through our communications. Consistency, limited information source. So Cindy mentioned a lot of the communication in the beginning came from me. And then I still continue and try, not as much now, but weekly, every other week, to just let people know when something seems important, when there's new testing sites available, when there's different things available, when there's some reminders that people need. We had some things this week where, people need to just be reminded of certain things. That's come from me. And I've been told by several people on campus that that's been really helpful, because they can go back and search their emails. If they knew it was told to them once, they didn't have to try to remember where they heard it. They knew they could go back and search their emails and get the information that maybe they didn't need that day, but they needed a couple weeks later. But that isn't the only place that they have that. There's that reinforcement then that we have a communication tool, so that information then goes on that communication tool and can live and breathe there too. And so there's multiple places that we're giving them the same information. There's this fine balance of streamline and not overloading. So what does the employee really need to know? Legal, safety, risk, that other slide, all of that thing that's coming at us. How do we boil that down? It's almost like you're doing some marketing for your internal communications group. How do you boil all that down to the pinpoint the relevant information that will keep that employee safe and informed? And how do you do that in the most effective manner? So I think that's the biggest piece of internal communications in COVID right there, is creating that confidence in what we're communicating. Speed becomes incredibly important. There was days that you had to get something out that day to as many people as possible, and you did it in whatever ways you had to. So in the beginning, there was a lot of paper on the walls, just so people had it and could not forget something. It was kind of in their face at all times. We've gotten better on how to disseminate the information, which I'll talk about next, but also creating single touch points. People are busy, they're overloaded, and I think being able to find the employee where they are is really important also. So they don't have to constantly be inundated with something, but yet they have it where they need it and when they need it. Be inclusive with all employees. So again, our employees are wired, non-wired, desk, not desk, remote. We have people driving around in cars and buses, and then we have people, sitting and stationary. And how do you talk to all of those people the same voice measured, and they all need the same information, even though they're doing things a little bit differently. Talked about listening a little bit, but there's also other ways to listen. People have a lot of questions, answer the phone, answer your emails, listen to their questions, figure out the trends and their needs, and that will help indicate some of the gap areas. And the consistency of those questions and trends will indicate some of the gaps that maybe you should be letting everybody know. So whether that's surveys, whether that's the union, whether that's side conversations when you're walking around campus, all of those things become really important. The anti-discriminatory, specifically and legally speaking, everybody is of the same risk, but yet we know there are some people that are have heightened concerns because of their autoimmune diseases or things like that. So we can't, we have to make sure our policies medically take care of everybody as though they're all high risk. And how do you make sure you're meeting everybody's needs and talking to everybody in ways that will be helpful, whether they are high risk or not. And there's a lot of, we need to keep engaged with folks. We need to respect people and their questions. We also needed to pay attention to people's self-isolation. So we have some remote workers that are single and are home, and they've been home for months, and their biggest source of sense of community was coming to work. And we took that away from them in sending them home, which was the right thing to do to keep them safe. But how do we keep them engaged, and what's the communication for those people, and how do we pay attention to their needs also? And then lastly, I touched on this before, but really it all kind of flows a little bit organically too if your policies are aligned with what your employees' needs are. So people are very concerned about their flexibility options to stay safe, and what those policies look like, and how to put all that together in a way that, in a package that they have their needs met, they know they're there, and they know what's available to them if they need it. So some of the types of communication, how we did this, we really viewed this as an opportunity to build a new culture through communication. So, when we started this in March, paper and communications were pretty fragmented. We still use paper because a lot of times that's the best way to meet our people where they are, but we've added some other things. In the middle of all this, we created a tool, a web-based communication tool that has an app. So you can go online to a website and as an employee get logged in and see all of our communications, all of your benefits information, need to know information, as well as log into your ADP, your payroll. So everything's in one spot, your pension plan, your 401k, that kind of thing. They're all tied together in one spot. So a centralized communication tool, and it also has an app, so you can access all of those things from your phone. So we, in the middle of all of this, launched this communication tool. And at this point, I think we're at about 70% participation, which has been amazing. And that was one of the biggest disconnects I think that we had as far as reaching the wired and non-wired. So how are you able to talk to people that work different shifts, that maybe at 2 o'clock in the morning are thinking, oh, I wonder if this covers when I go to the doctor tomorrow and this benefits information. And they're able to go access that information 24/7 at a time that's convenient for them. So that's been really a significant change for us. But with that, we have our people that are wired and non-wired, and we need to make sure that they're able to access the information because they don't have computers. So we also set up employee kiosks, self-serve computer stations around campus, and they included printers. So if you ask them to log in and look at their ADP payroll information, well, they might need to print a pay stub, or they might need to print a form because we're pretty paper intensive and we're trying to automate some things, but we want to make sure that they have access to take care of their needs. So really thought through not only how to put that communication out there, but if they don't have a computer at home and they choose not to do the app, they might want to pop in and take a look at something on the computer before they leave, and put those stations in places that they can access them and easily access them with some instructions and located by people. So we have one located by training, one located by some HR folks, and the other one is over by some management. So in a place that if they had a question, they would be able to go grab somebody and get that answered and be able to continue what they were trying to do. We also have video monitors. So that kind of started softly at the beginning of the year and then quickly escalated to video monitors strategically placed in various places, like our break rooms, the hallway when you come in, things like that. So we're able to kind of, again, boil down some nuggets of information, put it out there, and then get people's attention in some areas that we were trying to direct their attention. And then if they need more information, they can go to one of our sources that we talk about to get more information, or know enough to ask their manager or supervisor about it. The newsletter, I think, really became important. It's an every other week newsletter, and we did several things different. One, went to a weekly newsletter during the height of COVID, made sure that the information in there, again, was relevant. We were listening to people's questions, tried to answer questions for all employees that we knew, a high percentage of employees were asking. We also were able to disseminate that newsletter in some of these new ways, so we were able to reach more people. When we, in the beginning, when it was really important to talk to people, and I think it still is really important to talk to people live periodically, despite what we have going on, we can identify key times that there are more people on campus. Sometimes that if we need to talk to people, we can catch them, more people in the break room, and what are those key times, and we identified that per area to figure out if we had some folks come in and have some one-on-one conversations and allow people Q&A, when is the most impactful time to do that in small groups. And then we also needed to have more frequent board updates and union updates, and more think through, again, this relevancy around the newsletter, and create those paths of communication. Some of the town halls were replaced with different things. We've got, I just talked about the talking points where we could catch some of our people. We also were able to provide managers and call centers some talking points that they would need to know. Through our communication tool, we're able to do video, disseminate video now. So we can push out a CEO communication by video. So that kind of replaced the town halls in multiple ways. But we also needed to do two-way communication opportunities. So again, we talked a lot about listening, employee surveys. Cindy's going to talk a little bit later about a wall of hope that we created and intended to have a one-time thing, but we realized that people really enjoyed having that two-way conversation. Some of the other things that we did, again, really focusing on creating single touch points, how to automate more, how to have less paper in our forms and everything we do, how can we communicate better with less? And then we also actually moved part of our human resources group over into another building where our people pass through more often, and we're able to put those folks where the questions were. So as people were nervous and had questions, they were more likely to ask the right person if we put the right person in the locations that the employees were. So same as communication, putting the communication where the employees were, we used our human resources folks and the employee support center to create more of a centralized group to be able to talk directly with them. We talked a little bit about some of the workflow message going from remote or from office 8 to 5 to hybrid. Some of our tracking became more centralized, and our communication suddenly, one of the most important things was how many people are on campus, what's the attendance, who's on leave, and how we could shift to a more centralized reporting and tracking on any of that was helpful to all of our communication to answer a lot of people's questions. And then we've got, we also went through training. So we reduced service. We had a lot of extra time in some places. And so we went ahead and did our compliance training in small groups. So we went through, I think, 400 operators, almost 400 operators throughout a 3 or 4 month period over summer in small groups of 6 to 8 people. And that was actually really effective. We were able to have much deeper conversations than when you have a classroom of 30. And we were also able to, we had our first video training. We used Teams, Microsoft Teams, and we had our first video training, compliance training for some of our office admin folks, as well as we established a learning management system. So again, take it as an opportunity of how can we better communicate and train our people, and how do we put all that together to have all the voices be heard. Next slide. And then if you want to start the video, here's an example of one of the videos that we had about gratitude and purpose. It's just a minute long, but it'll give you an idea of some things that we shared for messaging. Is the volume on, Cindy?
Yes, it is. You can't hear it?
Oh, I can now.
We can hear it. The volume is not working.
So they
Yeah, I
didn't hear any of it?
I don't think we could hear any of it.
Oh,
Sorry,
shoot.
I wasn't sure that there was anything going on while you were doing that. But while maybe we can try it one more time, but while you're figuring that out, a quick question for both of you. You just went through a significant list of things that KCATA put in place to effectively communicate with your employees during this, and it's amazing and fantastic. But if you're a smaller agency, or you might not have the resources that KCATA has, Cindy and Susan, what would you recommend are your top 2 or 3 changes that were most impactful that other agencies could potentially look at implementing?
I can let Cindy say hers. Obviously the communication app tool that we put together was incredibly impactful. We were told by the company, the name of the company is Backstitch. We named it our own. We named it KCATA Link, so it has its own life here. But we were told by the company that we chose to work with that they had this quiet confidence about them when we talked about the tool. And now I know why, because immediately when that went into place, there was this breathing room that we had, that we were able to tell people, oh, hey, here it is. And they were able to access information. And it kind of slowed the chaotic churn of trying to get the communication out, because everything had a repository, it had a house to put the information in. So I would say that was the number one biggest thing we did. And I would say that even if you're small and you don't go get an actual tool, if you use that concept of a centralized communication location, and you recognize and embrace the fact that people are everywhere, on desks, non-desks, if you can embrace that and try to work around it instead of kind of fight up against it, then you'll have better luck communicating. So I would say that was the number one thing. But there's ways to get to that same effect without having to get a tool itself.
Did the volume work at all?
Yeah, I think if you restart it and even put the volume a little bit higher, that would be great. I can hear it. If not, we'll talk about what it is. Yeah, I think it's still not loud enough. I don't know what's going on.
We will be posting, Kim's going to post this on the
Okay.
website, so we will have the whole video available there.
Yeah, and same thing, the video communication, even if you're emailing your folks or putting the video on a monitor, or, monitors, TV screens aren't very expensive right now. So for a few $100s, you can have a pretty good sized TV screen that you put in a break room or put somewhere. And again, just think about your access points to be able to, if your goal is to communicate people, think about where they are and how you can do that. Because what we heard loudly is the people wanted our communication. And that was a lot of the information, that I shared. Those are the things that they really want to hear about. And so if your goal is to communicate with them, think about where they are and how you can reach them, whatever that is, even if it's a little unconventional. Back to you, Cindy.
Okay, thank you. I apologize for the video, guys. That was one thing we didn't try out right 2 minutes before we started here. So, but we will post this on the MPTA website so you can see the entire video. So thank you, Susan. Thank you. That was loaded with meat. I hope that you all got a lot out of that and at least gives you a glimpse at the thoroughness and the depth with which our team has put together communications for employees. And this next slide is just sort of a reminder. If you're on this call, chances are you are probably a leader in your organization. And it's just more of a reminder than anything, but that leaders have to model the expectations you want from your employees. So, our employees would love in the beginning just to have caught us without a mask, but that wouldn't happen. But, as we are reminding everybody's got to wear masks and putting in protocols, you've got to make sure that you are modeling the behavior you expect. And then we also, and Susan's already talked a lot about listening to employees, and we did that. And not only did we listen, though, but a lot of the protocols we are able to adjust on the fly. We're very nimble. And as we hear new messaging and new issues arise with our employees, then we can affect protocols very quickly. And then it's important that everybody be following the safety protocols. I don't, all of the, you guys know what to do, but just your employees are watching you. They're watching you for how you react, just like your children might look at parents. They're going to emulate, how you feel, and they're going to feel that way too. So if our leadership team is emulating and exuding confidence and hope, and that things are going to be better, and that we've got them, the best interests of our employees at heart, then they're going to have confidence in the leadership and in you all. And then recognize and reward your employees. Take time to write some handwritten thank you notes, whether it's your direct team or your operations staff, the video message, which we shared. And, just because we have to do a lot of social distancing and, we aren't able to gather in large numbers or have meetings, in person, we found some ways to do some very COVID safe events that still rewarded employees and just made it a little bit fun. One of those, I see my words got cut off somehow. Okay, we had a drive-through. What we had was a drive-through Kona Ice day. So we had the Kona Ice truck there and invited families and employees to come and enjoy some ice cream. And it was a drive-through, so it was still socially distanced. Everybody was still masked up. And we also used that as the opportunity to enroll people in our KCATA link, which Susan just talked about. So just because we have some limitations doesn't mean you can't find ways to still celebrate and reward and recognize our employees. And then somehow, and continuing in that vein, keeping it positive in challenging times. And probably the drivers have the most challenging time for us. They're dealing with customers who, they've got to enforce the rules. They've got to make sure they're in masks. And in our case, we're still zero fare, but some of you are not. And we've got a lot of challenges sometimes in making sure that the union, we don't get out ahead of the union. We want to make sure we bring them along with us. We've had some situations when we we spent a lot of time figuring out how we would present to the public our COVID cases. Now we've only had less than 10. We've had a very small number. And we decided we would only report to the public those who affected drivers, and then we could report on the routes that they were on. But at the same time, we spent so much time figuring that out that sometimes we got out, our employees didn't even realize that we had had some COVID cases. So we had to sort of backtrack a little bit and figure out how to accomplish the communication in a timely manner for both audiences. And KCHA Link, which I know we keep talking a lot about, but it's really a wonderful tool that, and it's almost like if you all don't have even that tool, you could have like an intranet, which could probably accomplish much of the same for you. We also are just trying to keep it positive as we enforce our policies, and always reminding people that the policies are not punishment, they're safety. And at this point in the game, I think most people are well on board and really are not having any struggles with following the policies. We have just had recent illnesses due to COVID. So I think getting in the habit of people or understanding the protocol of what to do took a little bit of time and training. But I think that is now down. They've kind of figured out what to do with that as well now. But in the vein of staying positive, and Susan mentioned our wall of hope, we created a wall of hope in our main building on campus at headquarters, where the most people come in, and just encourage people to express whatever they feel like expressing. This is an example, and it changes all the time. People are constantly writing new messages. And you might wonder, oh, are people going to take advantage of it and put inappropriate things on there? That doesn't really happen. It may have happened once that we erased something that was, just so negative that it didn't really belong on the wall of hope. But frankly, people are honest and grateful, and just having that little space that and drivers, especially the operations staff, stop and read it all the time. So it's something that we will continue. We thought it might be very short-lived, but it's turned out to be something actually meaningful for our employees. And I think you can read some of the examples on the slides of some of the things that people have said. But they're just thankful. And I think the further we get into this, the more we will have to probably diversify our communications and come up with some other new things, which I'm sure we will. And I believe that's our last slide, Kim. So I don't know if there have been any questions yet, but we'd be happy to take questions. And both of us really appreciate the time that everyone has given us today.
This has been a great performance, or great presentation, not performance. Thank you very much. As Cindy said, there was, I think, meat on every slide. So there are a lot of takeaways for people with regards to what they're doing at their own agencies and sites and how this can be impactful. We had one comment so far that they love the wall of hope idea. I do think that is a great idea to allow your employees to communicate their feelings as well, an opportunity, a sounding board for them. When did you establish that wall of hope throughout this COVID process? Was that from the very beginning, or did you just do that recently?
No, I can answer that. It's probably somewhere in the middle. I want to say it's been up there for 2 or 3 months at this point, probably 3 months. So somewhere in the middle. And in this snapshot here was probably our first thing where it was really more about hope. And then we had flipped it around. So when you ask about some of the things other people could afford, we had a lot of discussion. Where should the wall be? Should it actually be a wall? Shouldn't we have a whiteboard wall? And and then facilities doesn't like the whiteboard wall because of the damage it can do. So there was a lot of interesting discussion to get here. And what we ended up doing was buying one of these large whiteboards that's on wheels, and we were going to take it and move it around campus. And then we realized it just ended up in the right place the first time. And so then people were writing on it, and we flipped it around, and then we're like, well, people are still writing. They obviously have something to say. And so our theory was, as long as they have something constructive to say, we have had to erase, things here and there. But as long as it's a positive tool, which is what you can see on there, that we have asked them to do that, we'll let them keep talking. So then we kind of ran out of things to say. So we're like, where's your favorite place to go get a burger? What's the restaurant you miss the most? What's your favorite, jam tunes? And what are some strategies you use to decrease stress? There's always some notes on there of things we found out where we were having inconsistencies in paper towels or some of our supplies. We've all of us for various reasons have come to appreciate writing on it, reading it, and it's really been a great thing that probably cost us, $250. Sorry. We really appreciate it, and I encourage it. You might come up with some of your own ideas of how to make that happen.
That's great. That's really good information. So another question, because we don't have any in the chat box yet. So as a reminder to all of our participants, please feel free to add your questions to the chat box and we'll get those answers from Cindy and Susan. But when this first started and when everyone realized that this wasn't going to be a split-second event, that this was going to be an ongoing impact to our businesses and to delivering transit in Missouri communities, was there any communication tool that you put in place that you abandoned because it wasn't working at all? We talked about what was some of the most impactful changes you made, but were there other communication tools you thought that would work really well that you found at KCATA just didn't help you at all?
Think of anything significant. Can you, Cindy?
I can't really think of anything that didn't work because the way Susan reinforced meeting them where they are, the more we can do, the better.
Okay.
Not everyone reads the weekly newsletter or biweekly newsletters, but someone might see the bulletin, the monitor, the video monitor. So I don't think there's been anything that we've actually abandoned.
I think if I were to say one piece is the paper on the walls. When this first happened, we used the walls a lot. And then we've had to go back, myself included, walk the campus, kind of look at what's out there. In the beginning there was masks, no masks, and so really make sure as things changed, that we pulled away the old information. And probably the hardest place to do that was the paper. And then how do you suddenly have somebody walk in and have them maybe only 3 pieces of paper instead of before there was like 8, in communicating some of those guidelines. So I'd say that one has probably been the hardest to manage, but also important to meet them where they are.
And we just had a follow-up question that I think piggybacks right off what you just said, Susan.
Yeah.
How are you continuing the messaging? We're experiencing complacency and finding we're having to continually remind people of distancing, cleaning, and masks. Yeah,
a great question. Like I said, we had a situation earlier this week that I'll be honest, frustrated me because of that. It's the 3 basic things, like how could you forget? And they do forget, and it's just creative ways. So, whether it's your marketing group, maybe making a new picture, we're looking at that, freshening up our mask wearing signs. Could we have a different, sketch of a person with the mask that maybe gets their attention a little bit more? Is there a different, so graphically, I think it's people attention when they drive in. We're also used to seeing the sign, stop, wear your mask. Well, maybe we need to just shake it up a little bit. I think that, I go home personally at the end of the day and I'm exhausted from saying the same things over and over whenever somebody will listen. And so we on this call should all go home exhausted, reinforcing that message verbally. The first and best communication tool is really our voices and how we can share that. And then I personally am trying not to send out a message every week, because I do think people have fatigue and I don't think they're reading it if I send it out every week. So I'm trying to shake it up a little bit. It used to be Fridays, maybe I send it on a Wednesday. And maybe we bring in some different voices that we haven't been heard as much. And then how do we use our department leaders to disseminate some of that information? And, maybe there was a situation earlier this week that I sent only to the management team and I said, can you please share? So maybe when they hear from somebody that's a little bit different and the message is worded a little bit differently, that some of those things might help too.
And it's also, I think, taking advantage of the opportunities that come. So for instance, we're getting ready for our open enrollment. So we know there will be more people around, more people will be reading. So that'll be another opportunity to reinforce all of the safety protocols because they're going to read their open enrollment information. So sort of taking advantage of opportunities as they present themselves is very helpful.
We just had one more question. Do you have a policy that drivers must wear masks, and how do you handle those situations if they do not?
Yeah, that's a tough one, as well as the passengers on our vehicles. Our city and state ordinances, I don't want to say this incorrectly, even though they require the mask, they're a little bit squishy in the language of what that means. So our policy on campus is that we use all personal protection equipment that is required to do the job that you're doing. And we do require masks on campus. Now, sitting at my desk, I don't need to have one. If I get up and use the restroom, I need to have one. Same thing with the drivers. While they're out in public, they need to have their mask on. If they have people on the bus, occasionally we'll see somebody on a bus without their mask on. And if you look, there's usually nobody on the bus. So they're able to take a little break or a breather until somebody gets on the bus at the next stop and that kind of thing. So yes, for all of our employees, that is a requirement. How do you handle those situations if they don't? We generally call it out. We have support from our leadership. We try not to get in the practice of shaming somebody. However, it is a requirement. We've had enough communication around it. And so if somebody isn't wearing a mask, or if we have a trend in a department, we're all of our leadership is walking around campus regularly. We see what's going on. If we notice there's a department or somebody who's maybe getting COVID fatigue, getting a little tired, slipping here and there, we bring it back up to the leaders, let them know what's going on, and it seems to be quickly resolved. So I think it's a constant reminder to each other. It is really easy to forget. You're at home for a weekend, it's Monday, you get up, you start walking around, you're like, oh my gosh, I forgot my mask. So sometimes people just need a reminder. Sometimes people need a polite reminder of what 6 feet looks like and how to back up that space. As well. And I have no problem when I'm walking around campus. If I see somebody without a mask, or I see 2 people on break or, waiting to work the boards next to each other, I just ask them, like, why are you guys next to each other? Sometimes you get a response you don't want to hear. One time I got, oh, that's my cousin. We're going to go down together anyway. I'm like, well, that's great. You guys can hug at home, but you can't hug on campus. And we just, again, everybody on this call should be exhausting themselves, reinforcing that message constantly.
Thank you. Are there any other comments or comments, Cindy and Susan? We don't have any more questions right now. Any last comments that you think that people should really take into consideration when they're looking at their internal communications plans for their employees?
I think my big thing is to see it as an opportunity. I mean, we definitely stepped up our communication game. I'm new to the agency. I know there was things that people had wanted to do. We're like, well, let's try it. Let's try doing that and see if that leads us down to a path of better communications and being able to, I think Cindy said about being able to pivot and react quickly. And then the listening piece is, I call it introverts win. Suddenly we're listening to everybody, and there's some people that had some really good things to say, but maybe they weren't always the ones that were heard. So being able to be a little bit more opportunistic and try new things.
That's basically what I was going to say too, was about just taking advantage of the opportunity. I read today, I was reading an article about COVID and transit, and they were quoting former Mayor Rahm Emanuel has said in the past, never waste a good crisis. And so I feel like that's kind of where we are. We've gotten through the worst of it, I feel like, and now it's up to us and up to all of you to sort of find the silver lining in your organizations and kind of turn these challenges into opportunities that improve your business. And I know ATA is going to be stronger and a better organization at the end of this as we transition post-COVID, whenever that happens. So yeah, I agree with Susan completely. Take advantage of the opportunity and find the positive pieces in it so that you can keep your employees positive and engaged and full of hope.
Thank you. Thank you both so much. This has really been a lot of information for people to digest, but some really good and effective tools that they can use at their work sites, potentially even starting today. So there is one final question. Will this be available to participants for future reference? Yes, we will be posting this as a resource on the MPTA website. We did put that address in my first comments today. Thank you again to Cindy and Susan. Great presentation. We really appreciate it. We hope to have that presentation up in the next couple of days on our website. Also, as a reminder to all of our participants, our next MPTA education series will be on November 19th, and it will be looking at wellness at the work site during a pandemic and what does that look like. And we will have a speaker from Bi-State Development, their wellness coordinator there in the St. Louis region, talking about what they're doing with regards to employee wellness during this time. So hopefully you'll be able to join us on November 19th. Thank you again to our speakers and to KCATA for your support of MPTA and providing information for others to learn from. And everyone stay safe, and we will see you in November, hopefully. Thank you.
Kim.
Thank you.